Nobody is going to refute that antibiotics can be life-saving. In the right context, in the right setting, these are absolutely game changers, and we need to have them. But I've also seen, in my 15 years of practice helping patients with IBS, I've seen these create an entire different set of reactions that are non-desirable and that can often be quite serious for people. And that is when those antibiotics are not prescribed in the right time, in the right place. You know, the good news is there is a way to help you with your IBS. And we can do that without rolling the dice on your health by taking antibiotics as a first-line approach. I can tell you with certainty that many of my medical doctor colleagues, one of their biggest pain points and frustrations in clinical practice are working with patients with IBS. Now, there's no doubt in my mind that conventional medicine is a huge cornerstone for healthcare and is very important and saves many lives. However, IBS is one of those conditions, unfortunately, that tends to fall through the cracks. And that is because not every IBS patient or case is exactly the same. We have to help patients customize this a bit better and help them get to the root of the problem. Unfortunately, when we prescribe antibiotics can kill the bad bacteria, correct, but unfortunately they can create a massive disruption in our gut microbiome, which is a collection of all these different microbiota. These could be bacteria, yeast, even parasites and viruses to some degree are part of this microbiome. And when you disrupt that, you can create all sorts of other potential issues to arise. For example, we see a lot of yeast overgrowth when people go on antibiotics unnecessarily. So it's time to find a deeper meaning of why these IBS symptoms are there and start to peel those layers back and get to the root of that without rolling the dice with those antibiotics. What I absolutely love to do with my patients is help them get to the root of their issues. And this is no more important than it is with IBS, because IBS is so multifactorial, it's so unique to each person. We've got to start asking the question, is this due to hormonal imbalances? Is this due to food sensitivities? Are there other infections that are hiding that we need to be treating them other than with antibiotics? Sure, antibiotics can be part of the treatment, but they're not always going to be the only treatment to help somebody get over IBS and stay away from that going forward. We also want to consider nutrient deficiencies or other toxicities, and this really helps us get to the root of the issues, uncover those blind spots, and treat the person as an individual. So for more tips and guides, please head over to thehealthygutinstitute.com. There's tons of information there, and I'll see you in the next video.